Welcome to the deep dive. Today, we're really getting into it with a stack of sources all about cardiac health.
Yeah, really important topic.
Absolutely. We've got reports, studies, fact sheets, mainly looking at heart disease and stroke. The goal here is pretty simple. Cut through the noise, pull out the key insights, and give you a quick, solid take on the latest research.
Mm-hmm.
We're focusing mostly on stuff from the American Heart Association, the CDC, plus some, heavier academic reviews. It's really about seeing how all this data actually shapes what we know about heart health.
Exactly. And what's really interesting, I think, is how these different kinds of sources fit together. You've got these broad updates, then these really focused looks at specific conditions. It paints a very current picture of the challenges. You really see the effort involved.
Okay, perfect setup. So let's jump straight into what these documents are telling us. We've got a couple of really fresh ones from the AHA, both 2024, Heart Disease and Stroke Statistics 2024 update. One's from the National Center for Health Statistics, the other's published in Circulation. So straight off the bat, what's the biggest takeaway you pulled from these brand new AHA reports?
Well, the thing that jumps out from these 2024 updates is sort of a mixed bag, actually. On one hand, there's some good news. Overall, death rates from cardiovascular disease are still going down, especially in older folks.
Okay, that's positive.
It is. But the circulation report flags something pretty worrying. It looks like we're actually seeing an increase in the big risk factors, things like high blood pressure, obesity, diabetes, but specifically in younger adults, like under 45s.
Wow, really? An increase in risk factors for younger people. That kind of flips the usual narrative, doesn't it?
It really does. It suggests that, while maybe we're getting better at treating the immediate events for some,
Yeah.
the underlying problems might be starting much earlier for a growing group.
Huh. Does the report give any hints about why that might be happening? Or is it more of a, here's the data, alarm bells ringing kind of thing?
It's more the latter, I'd say. It
Right.
definitely signals an urgent need for more digging, but it really underscores why these constant updates are so vital. They don't just track progress, they show us where the new challenges are popping up.
Right, it keeps the focus current.
Exactly.
Okay, so the AHA stats give us that wide angle. But then, like you said, we have sources that zoom right in. And it seems heart failure is getting a lot of this focused attention. We've got a 2023 heart failure fact sheet from
Yeah.
the CDC. And just quickly, heart failure, that's when the heart can't pump blood well enough, not when it stops completely.
A crucial distinction. Yeah.
And then there's a 2020 review in Nature Reviews Cardiology about the global picture of heart failure, and a 2022 paper in JAMA Cardiology looking at U.S. trends between 2011 and 2019. So why this spotlight on heart failure across different types of sources? What story do they tell when you put them together?
That's a great point. It definitely shows heart failure is a major and growing concern. The CDC fact sheet gives you the quick snapshot, right? Like over 6 million adults in the U.S. have it, and it's a top reason for hospital stays for people over 65. Very clear, very direct info.
Okay, stark numbers.
Yeah. But then the academic papers add these, deeper layers. The Nature Reviews paper, even though it's from 2020, really highlights the global differences, how much things like income and access to care affect heart failure rates and outcomes around the world.
So big disparities there.
Huge. And then the JAMA Cardiology paper, looking just at the U.S. from 2011 to 2019, finds something really interesting. It suggests that even if some other cardiovascular disease rates are improving or holding steady,
Yeah.
the actual rate of new heart failure cases hasn't really budged much. It's persistent.
Hmm.
And possibly this is partly because people are surviving other heart events, like heart attacks, more often now.
Ah, okay. So better survival rates from acute events might mean.
Might mean more people are then living longer with heart failure as a chronic condition down the road.
That's fascinating. And yeah, kind of sobering too. So progress in one area might be contributing to a different kind of burden later on.
Exactly. It shows just how interconnected everything is.
So these documents aren't just giving us numbers. They're really tracing these evolving challenges in heart health.
Precisely. You see how researchers use everything from these broad national stats to global views to these detailed U.S. trend analyses to try and understand something like heart failure from all sides. Where are we now? What's happening globally? And how did we get here? Helps predict what's next.
Right. So pulling it all together, what's the big takeaway for you, our listener, from looking at these different pieces? It seems pretty clear that understanding cardiac health isn't a one-and-done thing. It's constantly shifting. We're seeing new patterns like those rising risk factors in younger people, or this persistent challenge of heart failure even as other things improve.
Absolutely. These reports are more than just data points. They're like, well, roadmaps showing where the field is heading and where the new focus needs to be.
Yeah, constantly updating roadmaps.
Which leads to, I think, a really important question for you to think about. Given that we have this constant flow of new stats, new research highlighting these changing trends, how do you think we as individuals, as public health bodies, can best use this evolving knowledge, not just to react, but to actually get ahead of the curve in preventing and managing heart disease in the future?